I wish to thank both the speakers for great presentations and fascinating to listen to them. My question's for both of you, same question for both of you. Self-testing. Given that you're looking for 2.1 million adolescents, there's 1.8 billion, I just looked it up on Google, thank you for the advice, 1.8 billion adolescents in the world. It's chasing very few numbers. Mm-hmm. What's your feeling on self-testing? And the tough end is at what age, given consent was mentioned by Father Kelly, what age and what sort of way should we allow self-testing to be used to reach people?
Brilliant. So self-testing and consent, we might hold on to that question. Yeah. Anybody else? Come on, we have to have more than one question after that. There we go.
Thank you so much for being here, and thanks for all the work that you do. I'm very interested in the mobile health clinics that you mentioned, and as well community health workers. And I'm wondering what your thoughts are on implementing programs like that in hard-to-reach areas for HIV testing, STI testing, condom distribution, education, and overall prevention.
So fantastic. So that's the Brazilian model. Anybody else? Yep.
Thank you very much, Mark Fitzgerald. And I just want to say, 11 years ago, you came to the project. I was working in Malawi and PMTCT, and you, with MSF and the Ministry of Health, and you galvanized us into action. And I think we really can see the phenomenal gains. But to sustain all the efforts that you referred to this evening, and even in our own country here, where we have a rising problem of HIV, in particular in our vulnerable groups and in those not born in the country, how do you continue to mobilize the international community to sustain the efforts? Mm-hmm. I think there's a huge amount there you said we need to do, and how is that going to be sustained if there is a certain lack of enthusiasm to keep going with the money?
So we've self-tested, we've got the bus, and we've got the mirror turned back on ourselves in terms of the international community. On there, Bernie.
Despite all the efforts that have been made over the past 20 years, all the money that's been spent, there's still a continuing rise in infection. Is that possible? Is it possibly because it's now generally accepted that it's no longer a death sentence, that you can live with it, that the treatment is so much better? And certainly I would suggest that that's possibly part of the reason why it's on the rise in this country.
Okay, so are we getting complacent? Anybody else?
Hi, and thank you both. My question is related to the PrEP programs, and in Ireland we actually don't dispense PrEP. But if you are able to sort of access that younger cohort, is it something, if it was started at a much younger age, I guess, is that feasible? And if it was, I guess for you, Delphine, is that just another stigma of something else being added on top of a program that could be successful, but the stigma would hold it back?
Okay, maybe one last question at the very, very back.
Alors, this question is for Daphine. I praise the organizers, Arishade, I believe, for this event, for having Daphine here tonight. My question to you, Daphine, is that if you could tell us, you have touched about it a little bit, but I was just wondering if you think that there would be maybe 2 or 3 ways of trying to combat stigma and discrimination. What do you think that there would be? You know, like a couple of lines of actions for us to be able to combat stigma and discrimination. And just because I have the mic, just 1 minute, I work for World Vision Ireland, which is a child-focused organization. And I just wanted to say that, and you have touched about it, Madam, a little bit in your presentation, as adolescents as active agents of change themselves. And my question to you is that what do you plan to try to have more adolescents in the room to be able to find out about how to reach to these adolescents? I think, with all due respect to each one of us in this room, the only person who can answer this question is truly Daphine. The median age right now of the worldwide population today, and I'm going to give you this number, it means that 50% of the population is above this number, 50% of the population is under. Today, the world, in 2015, it was 29.6 years old. In Uganda, the age is 15.9 years of age. The population in Uganda, 15% is above 15, 50% is less. And Malawi, 17.2. So what I mean by that is that this active agents of change and this example that you had about the Brazilian mobile health is interesting for me because I think that we need more and more these young people at the table. And I think that you have touched about it upon a little bit, but I would like to know more about that.
Thank you. I'm answering the lady's question because I think it's all about me. But the question you asked is directed to her because I'm not so much of a scientific person. Thank you. So, you asked of the ways we can combat stigma among young people living with HIV. First and foremost, I cut stigma by disclosing my status. And how did I do it? I decided to live a positive life. How did I decide to live a positive life? I was trained as a peer educator under Link Up Project and International HIV AIDS Alliance. So if we could have more other projects to educate young people about HIV, this will lead to disclosure, hence cutting stigma. Second of all, it depends on the way we treat these young people who are positive at home. For example, for me, after I had lost my mom in 2013, the auntie I was staying with pushed me out of her home. Like she chased me away because she told me, Daphne, when my kids are going back to school, you should find your way out. That was stigma. So if we don't show these young people who are living with HIV some love, okay, actually not some love, but showing them love, then how shall we combat stigma? But me, I cut stigma because I got people who loved me. Just imagine your mother's mere friend. Your mother's sister chased you out, and your mother's mere friend is bringing you in. So that's respect. Thirdly, there are ways that health workers deal with young people also depends. If I get to a clinic and I've come for services, of course, a youth clinic should be friendly. It should be a youth-friendly clinic. How do you expect me to find a grandmother in a youth clinic? So it should be a youth-friendly clinic, meaning it should have some young clinicians. And this will combat stigma because it will give me freedom to speak to the doctor I'm with. So I think those are the ways we can combat stigma. Actually, some of the ways.
Yeah, stigma is a big issue, especially stigma in the healthcare setting as well. But what I saw in Malawi, and thank you for the person that talked about Malawi, because I worked with Malawi on their PMTCT program for a very long time. But one of the things that was fascinating for me is when I went back to visit one of our programs, and we worked hard to have peer support groups of mothers at the community level, and also mentor mothers to support the mothers individually. And these women were empowered, and they could talk about any issue, they could talk about their experiences. The problem is that most of the time we just don't listen. But what was fascinating for me, at least when I met with these women, is that in the meeting that we met, they also brought the chiefs with them, the people that are in charge of those communities. What was fascinating is how much the chiefs were aware of the experiences that these women were having and what they're doing about it. The irony of this whole story is that actually we started the meeting with the chiefs and the women, and we had a very vibrant discussion on what's happening and how communities are starting to combat stigma, led by the leadership at the community level. The nurse in charge of one of the community clinics who was supposed to come now, because we're trying to foster the community facility linkages in this particular program, she came late. So we had been having a joyful discussion, and when she came, there were questions posed to her that we had been discussing about what's happening in the clinic and the experiences the women are having. This woman had no clue that all these things were happening. So I think what is good is that recently the global AIDS community has issued a statement, and there's going to be some guidance coming out of that in how we can actually help facilitate ways in which we can reduce stigma, especially in the healthcare setting. Now, I'm not undermining the fact that there's all kinds of stigma towards people, especially like key populations and how we combat that. But all I'm saying is that we need to work on it, especially if we're going to end AIDS by 2030, because stigma is going to be one of the critical bottlenecks if we don't address it. The self-testing, I like it, the question on self-testing, because immediately the self-testing guidance came out. Again, at UNICEF, we started to talk about we need to make sure that adolescents have access to this. What is interesting in the whole self-testing movement, led by a number of people like Population Services International, PSI, with funding from UNITAID, they've been doing this work in the field now, trying to get people to do this. And what's interesting in the data, and data after data, is that the people that are standing in front of the queue in terms of access are adolescents. Adolescents love self-testing, and they're coming up to it, and they're doing it well. The issue becomes, if we have to have a public health approach to this, I think the question around what age is important, the only thing I can tell you is that my answer would be context and understanding the readiness of adolescents to do this on their own, and who can do it, who cannot do it. But in a public health program, that's very difficult to do. What we've done as UNICEF up to now is that when we push for these things, we go by the laws that exist in that country. Now, that may not be perfect, but I think for me, it's still a starting point, because people have to feel comfortable with something, especially policymakers, to move it forward as a policy. So if you come and your starting point is from a position of weakness because you have to negotiate age of consent before you do anything, policies take long to do. I've done policies in these countries, and I've changed legal frameworks in these countries. They take a long time to do. So for me, my advice would be we start from where that country is at, and if we can negotiate for pilots to do it in much younger age group to understand the implications of doing this, let's do that. But I would actually say we start from where the country is in terms of their own policy. The question on how do we sustain is a difficult question, and it's at the center of all the discussion we're having on HIV/AIDS. The resource envelope, especially on treatment, is huge. And that's why I think the conversation in the last year has shifted to say we can't treat ourselves out of HIV, and we have to do more on prevention. And we have to close that tap of new HIV infections. But having said that, there is a real push for governments to do more. There's a real push to support governments on how to do this effectively. And recent data is indicating that more and more governments are stepping up and putting money on the response. But I think that in terms of what needs to shift, we're also talking a lot more about integration and alignment to make sure that we move away from siloed HIV programs, take HIV out of isolation and bring it into the center. Now, that conversation around integration goes in different directions. One, it scares a lot of people that have been used to funding HIV vertical programs to say now we're asking them to fund everything else. And they also feel that that approach might dilute the impact of the work that we've done, because now you're doing this within a broader scope of things. But the other discussion, which I think is much more pertinent, is how do you do this effectively? How do you integrate and achieve the same results or even better results? And I think that requires a little bit more work. Where we are with UNICEF is that I've actually said what we need to do right now, between now and 2020, is effectively integrate what we do in the broader space of UNICEF work. But I've also said it has to be managed. You can't just say, today I'm doing it this way, tomorrow I'm going to completely integrate. I don't think that would be helpful. The issue about complacency, increasing infections, I think the data from the US and other places where we're seeing more STIs in people who have sex with men who have sex with men, I think is a true illustration of what's going on, because we've reduced on our communication and mobilizing, and we're focusing more on these things work. You can take PrEP and you don't get infected. I think it's true, and we have to do more to make sure that we don't lose that momentum. The difficulty is also how do we sustain it at a time when funding is actually going into other things? A lot of us are concerned about that. In fact, for me, when I speak to my executive director, I talk about polio, and I say, we said we're going to end polio when, and we still have a problem with polio. We can't take our eyes off HIV. That's a difficult take, but that's the reality. We cannot. And I hope that we can continue that advocacy. A lot of the civil society are worried about the fact that funding to civil society is going down. And the reason why we've had money for HIV is because civil society has done their work to make sure that governments are accountable. But now, with the diminished funding, we're also seeing a decline in funding for civil society. So it's a challenge, and we just need to keep at it. I think PrEP, I answered, right? PrEP at a younger age group, and how do we sustain it? It's difficult, but I also feel that for me, risk is not the same. And I think that for adolescents, there's a point in time when we need to push them to take PrEP. And I'm hoping that as they grow older, that risk becomes less manifest. But we haven't done enough work in this for me to even know how to respond to this question. And this stigma issue, how it builds into that. But I think these are important questions that we need to build into any work that we're doing on PrEP and adolescents. Right now, what we have is just a green light to do it, but it's going to be a challenge. I know that. Okay, so I think I've answered all the questions.
There's one about the mobile units as well.
Oh, the mobile units. You know, as important as it might seem that you can actually map out areas of risk and you can reach out through mobile vans at times that are appropriate when these young people congregate, and make sure that you have a much more holistic approach to the program that doesn't just focus on HIV, but you build in other things as well to make it fun, which is what we're doing in Brazil. The difficulty with that, because we took that particular model to potential funders to try and do more of this, what we get is a pushback most of the time to say that it's not sustainable. And how are we going to do it across many places in a country? So, I mean, in one way, we know that we need to do things differently. But at the same time, there's also issues around this is not a public health approach. This is not, has to be sustained. And how are we going to do it? So my feelings are very mixed at the moment as to what is sustainable and what do we need to do. There's always a difficult balance. The Mwanza study in Tanzania was a good example of a study where, in the spirit of trying to say we need to make it cost effective, the intervention actually lacked many ingredients that would have made it work. And then the study concluded that it was the study did not show any effect. But so it's a difficult balance when you do this. I've done a lot of orphans and vulnerable children studies and work in the countries. It's the same thing, even when you talk about cash transfer, as to what amount are you talking about that would have an effect on a family, on children. So this dialogue of sustainability for me is a very difficult one, and we still need to continue to work on it.